Dr. Matt Harkness, your team physical therapist. Today we're going to talk about a common injury called shin splints. So if you look up here on this image, you can see that the pain is usually at the front of the shin, and what happens is you get some micro tearing of the muscle on the bone, and it's very painful. Usually when you walk you feel a lot of pain on the front of your shin. And you also, when you run, you'll limp because it's quite painful. So let's talk about the causes of shin splints. So the first thing that commonly causes shin splints is a change in your cleats or shoes. So if you get a new pair of shoes or a different pair of cleats and you go out and practice at your usual intensity, the change in the shoe will actually cause more stress in the shin. So another cause will be running longer distances than usual or running at higher intensities than usual. I know the U16 team, they've been doing 4 laps around the soccer field, and we've had a couple of the athletes complain of shin splints, and so we've had to be working with those. Also, another cause of shin splints can be lack of flexibility in the ankle. So maybe you haven't been stretching, or maybe you had an ankle sprain, which we've talked about in previous episodes, and the joint's still stiff and you'll develop some shin splints that way. Okay, now we're going to look at 3 ways to treat shin splints. The first way is some rest and reduce intensity. So if you have some shin splints, take a break, or when you go out to do your training, do about half the intensity and just do a light workout. Usually it'll last for a week or 2, and then you can start to ramp back up to your new intensity. Also, you can use a foam roll. So let's take a look at this image and we'll show you how to use the foam roll. So this is a foam roll, and what you can do is you can take your shin along there and just massage that front part of the lower leg. And this will help to improve circulation. It'll help to break up any scar tissue there and help to increase the mobility of the muscle and the soft tissue. So this is an excellent treatment technique. Alright, the next thing we're going to show you is using KT tape. KT tape is very effective to help to also improve tissue mobility and circulation in the area. So let's take a look at how to put on KT tape. Okay, I'm here with Riley. He's a runner and he has some shin splints. So Riley, tell me, where has it been hurting you on your shin?
Basically it's right up in this front area right here. It just hurts a lot when I try to pull my foot back.
Okay.
So.
Alright, well we're going to do some KT tape to help to relieve this discomfort. I'm using 3 pieces. I've got a whole piece here, and then 2 half pieces. So when you put on KT tape, there's some backing, and we're just going to tear off, make a tear in about 1 inch from the bottom. And the tape is stretchy, and you just pull it off. So what I want Riley to do is kind of push his foot down. Okay, and then I'm going to position it. This is called anchor, the first piece. Okay, and then I'm going to rip it about 1 inch from the top. I'm going to pull the back off. It's important that you don't accidentally touch the skin and lift it and reapply it, because it won't stick. So now what I want to do, bend the leg a little bit, is this is the area that's hurting, so I'm going to stretch the tape and then just lay it down. Rub it in good so there's some nice friction there, so the glue, it gets nice and the adhesive will activate. And then I pull off the top piece and I just lay the top piece down. Okay? And then we take these 2 other short pieces, and most of his pain is right in here, so we're going to do a little extra support right in the area of pain. So I'm going to put it on the skin, and again, ripping about 1 inch from the top, pulling off the center section, and then I'm just going to put a nice stretch and go around and take off the rest of the back and apply it. I like to use 2 strips for a little extra reinforcement. I'm always on the field, so I can teach you how to do this. We also have the KT rolls available for you, for your convenience. And you can do this yourself, very easy. Okay, there you have it. So shin splints, very common injury caused by maybe a change in shoes, maybe a change in intensity in running, or maybe a lack of ankle flexibility. So 3 treatments that you can do. You can do rest and decrease intensity. You can also do some foam rolling, and you can use KT tape. We'll see you guys on the field.